My name is Anthony Ogugu. I am doing my video on the sheep heart today. If you will follow me, I'd like to begin with the apex right here, and on the other side, this will be the base of the apex. This will be our right atrium, and then the left atrium. I'm going to look at here. This will be, let's see here, our interventricular sulcus. The ventricle sulcus right here. Okay. All right. Well, let me go in here and just dive into it. But before I do that, the fibrous pericardium, the periatal pericardium, and the visceral pericardium are all they are surrounding outer walls around the heart. So for the fibra, it's like a sac that lubricates the outer walls of the heart, and the other one, the periatal pericardium, also an outer layer. In the visceral pericardium is the inner wall of the pericardium. So these three are thin layers surrounding the heart. Okay, I'm going to go back in now. I'd like to begin here. Here will be our right atrium, our right atrium, and the left atrium is right here. Goes in through right there. Okay. Then the right and left auricles. These are the outer part of it. Right and left auricles. These are the outer part. Right here. They are ear-like structure, and there you can also access them from within here also. Right auricles. The right atriums are oxygenated, while the left atrium is oxygenated. Okay. What are the right and left auricles used for? The right collects the oxygenated blood and pushes it to the right ventricles, while the left auricles collects oxygenated blood from the lungs and pushes it towards the left ventricle. Okay, so we already talked about that. We talked about the right ventricle. Right ventricle. One of the ways to tell, if you look at this, you will notice the walls here are much thinner. And so this will be the right ventricle, and this will be the left ventricle. So right ventricle, and then this will be the left ventricle. So the walls here are thinner there. Next thing is the let me use this one, is the pulmonary trunk. This will be the pulmonary trunk. It goes right through here, through the ventricles here. So that will be a pulmonary trunk. Where is the blood going to is the question. Blood is going to the lungs. It's going to the lungs. The aorta leads to the semilunar valve up in the left ventricle. So it leads to the semilunar valve up in the left ventricle. and the blood here is oxygenated. Ascending arteries is one of the, see, they've been cut off on top here. So is the base of one of our openings on top here. And then the aortic arch is a point. It's a point of the base for one of these the outings that we have on top here. And then we have the brachiocephalic arteries. Here it is being cut off also, but it's supposedly supposed to be around here. And so is the left common carotid and the left subclavian. They are all up here in this place. Okay, right. The superior vena cava is in here, so this will be the superior end, and through here will be the superior end of it. Okay, it goes the blood from this from the superior end of the vena cava goes into the heart through the right atrium. Inferior, like we already talked about the inferior, so it goes through the end of it. And this one, they are veins. They are veins, vessel veins. They drains and collect from the lower extremities. But these are vessel brains. The coronal sinus is right below, around all the veins in the trunk. I said earlier, but we have some of our trunks here, so it's right below the veins of the trunk, and this is the blood here is deoxygenated. Okay, internally, the inferior. I meant to talk about the patella muscles. Will be around the inferior vena cava, which leads to the right atrium. Leads to the right atrium, and then the myocardium. You have the right and the left myocardium. This is the right, and this will be the left myocardium. They are middle thick areas that separates both verticals, and the one on the left is so thick because it does more work in relation to the pumping of blood, so it needs this size in order to effectively pump the blood. Then we go on to the trabecular crema. That will be the wall on the verticals, around the wall on the vertical. And then we have here the biscopy. There are nerves around the upper verticals of the right side, so there are nerves around here. And then the the tricuspid. Tricuspids are also nerves in here. If you look at them, there are about 3 of them that are in there, a tricuspid. The Chandian tendinous is in here also. Chandian tendinous is in here. And there's a little bump here. This little bump here is the papillary muscle. Papillary muscle. And then, of course, the whole through the left, through our left vertical is the pulmonary SL valve. Pulmonary SS valve. The outer SL valve goes through the right vertical. And that concludes my presentation for today.